Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the iliotibial tract. What is iliotibial tract? The iliotibial tract is the thickening of the deep fascia, the fascia lata, on the lateral aspect of the thigh. So, the definition of iliotibial tract, definition. Okay, it is the thickening of the fascia lata or deep fascia of the thigh, that is the deep fascia of the thigh on the lateral aspect of the thigh. So we got the iliotibial tract is the thickening of the fascia lata. Fascia lata is the deep fascia of the thigh. This is the deep fascia of the thigh, and that is the thickening on the lateral aspect of the thigh. This is the fascia lata. Lata thickening, we call it iliotibial tract. Okay, this is the iliotibial tract. That is the thickening of the deep fascia or fascia lata of the thigh on the lateral aspect of the thigh. Okay, so what is the extension of this iliotibial tract? Extension. It extends from the iliac crest to the lateral condyle of the tibia. Okay, it extends from the tubercle of the iliac crest to the Gardis tubercle on the lateral condyle of the lateral condyle of the tibia. Okay, so here we'll get this is iliac crest, we'll get iliac tubercle. This is the iliac crest. Okay, iliac crest, and this is the iliac tubercle. Okay, here is the lateral condyle of the tibia, and we are getting the Gardis tubercle here. Gardis tubercle. This is the medial condyle of the tibia, lateral condyle of the tibia. This is the tibial tuberosity. This is tibial tuberosity. This is the medial condyle of the tibia. Okay, we got the extension of the iliotibial tract. Again, this is the thickening of the fascia lata on the lateral aspect of the thigh. Okay, how wide is this? It is about 5 centimeter in an adult male. Okay, adult male. It may be variable from person to person. Around 5 centimeters. That means almost 2 inches. Okay, so we got the iliotibial tract extension. Now we'll go what muscles are inserted into iliotibial tract. Muscles inserting into the iliotibial tract. Muscles inserting into the iliotibial tract. Okay. We have 2 important muscles. One is the tensor fascia lata, another one is the gluteus maximus. From anterior aspect, the tensor fascia lata. Tensor fascia lata. From posterior aspect, we have the gluteus maximus. Gluteus maximus. Okay, the 2 muscles inserts into the iliotibial tract. From the anterior aspect, tensor fascia lata. From the posterior aspect, the gluteus maximus. Around 75% fibers of gluteus maximus is inserted into the iliotibial tract. Only 25% of the gluteus maximus muscle fibers inserts into the gluteal tuberosity of the femur. So, we have 2 important muscles. One is gluteus maximus and this tensor fascia lata. Again, this is the thickening of the fascia lata extending from iliac crest to the gardis tubercle on the lateral condyle of the tibia, just below the knee joint. The iliotibial tract has 2 muscle attachment. We must add one more point. The iliotibial tract, the iliotibial tract is also connected, you can say attached, okay, is also attached to the lateral lip of the linea aspera. Linea aspera of the femur by the lateral intermuscular septum. Lateral intermuscular septum. Okay. So its attachment here to iliac crest to the tibia. It is also attachment by means of the intermuscular septum to the linea aspera. Linea aspera is a thickening in the posterior aspect of the femur. We got that. So we got the attachment, we got the muscle inserting into the iliotibial tract. Okay. These 2 are very important muscles. One is gluteus maximus, another one is the tensor fascia lata. So gluteus maximus. Okay, this muscle, what is its nerve supply? By means of inferior gluteal nerve. Inferior gluteal nerve. What is the root value? L5, S1 and S2. What is the action of gluteus maximus? It is the chief extensor of the hip joint. It stabilizes the iliotibial tract along with tensor fascia lata. It is also a lateral rotator and abductor of the hip joint. Okay. It helps a person to stand from sitting position by its attachment to the iliotibial tract. This muscle stabilizes the knee joint, and also its action is on the hip joint, like that, with that of the tensor fascia lata. Okay, we got gluteus maximus, then tensor fascia lata. Okay, this muscle is coming from the anterior aspect, so it is adductor, not abductor, adductor and medial rotator of the hip joint. Plus, it stabilizes the iliotibial tract, stabilizes the joints, the knee joint and the hip joint, along with the gluteus maximus. Okay, so this is an abductor, this is adductor. This will cause lateral rotation extension, this will cause medial rotation. Tensor fascia lata. What is its nerve supply? Superior gluteal nerve. What is the root value? L5, S1. Okay, we got two muscles and attachment of the iliotibial tract. So we got iliotibial tract, its attachment. Okay, so what is the clinical importance? What is the clinical anatomy? Okay, iliotibial tract is very important for stabilization of the knee joint and the hip joints. Its lower attachment is just below the knee joint. Okay, so it stabilizes the joints. Any injury or trauma that will cause the instability of the joint, any injury or trauma to the iliotibial tract. Okay, we have one syndrome called iliotibial tract syndrome. Iliotibial tract syndrome. Okay, this is mostly found in the athletes, especially the joggers or runners, or some type of sports where a lot of running is required. In that condition, iliotibial tract may be tense, may be torn, damaged, and will get iliotibial tract syndrome. In that condition, stability of the knee joint will be lost, and the movement of the hip joint would also be restricted. Okay, so that's all about the iliotibial tract. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel, subscribe me, and have a nice day. Bye now.